Greetings, my fellow nurse brothers and nurse sisters. My hands are already clean. I've been washing them. But I do want to tell you right now, guys, especially with what's going on, I wanted to talk about something serious about coronavirus, aka COVID-19. We know that this virus is a pandemic situation going on right now. It's like mitosis. We're going 2, 4, 8, 16, and so forth. We just keep growing in these numbers, and it's so hard to understand and bear as a registered nurse, as a student nurse right now in school, and all my other doctors going to medical school too, and the current doctors and everybody in the healthcare field, phlebotomists, lab techs, x-ray techs, our physical therapists. I'm talking about everyone in the field, and my NPs too. We're all working together as this virus is spreading like a wildfire, and I don't like the outcome of this. I know a lot of people don't, but we're talking about this for our future, because this is what we didn't sign up to not take care of people without the proper protective gear. That right there kind of hit me at home. I didn't like that, but it's happening currently right now because it's spreading so fast. So we know about this coronavirus. Let's just talk about what we've learned so far about this virus. So far, this COVID-19 virus, they say that it's basically with humans and animals. But it's novel because it's never been here before. It's a new type of virus that has spread so rapidly, so quickly, and it's been jumping from person to person. And I'm talking about droplet. That's why they say social distancing at least 6 feet. We know that it's droplet, especially when you cough. You know, you want to use and flex that elbow, but we'll get into that in a little later. My biggest thing right now is currently with public health and CDC, they have confirmed already many cases, but they're talking about from person to person. So I did say 6 feet. I know that they're respiratory droplets, and they definitely want us to make sure that we don't spread this. I know they say quarantine yourselves if you don't meet the criteria. So there's a lot of confusion going on. If you don't meet the criteria, then you can't get swabbed. You're not going to meet criteria to get tested for it. I think everyone that has a small cough, a small sneeze that's happening at the time, and they have a small fever, go get tested, which means you got to call the doctor, healthcare field, urgent care, wherever you're going before you're coming to let them know you're on your way. But my biggest thing about this is they're trying to come up with a vaccine in the meantime. But for us registered nurses, the hardest part about this is trying to understand how this has spread so quickly, how currently right now our government is kind of shorthanded on helping us out with the protective gear, and also with the N95 mask, with the PPE protective gear also. So it's kind of hard to put that all together in perspective. And we're running low on supplies and we see cases increasing. That's going to be a bad outcome. So we got to get together, guys. On the bottom, just comment about discussion about COVID-19, how it's spreading in your state, in your country, wherever you guys are at right now. And I do want to kind of just put this out there real quick, guys, because my biggest thing, I kind of wrote this down, according to the World Health Organization worldwide. This is worldwide currently right now. Today, we're talking about Wednesday, March 25th at 19:13 on the clock. So I'm telling you right now, worldwide, there's 468,644 that are confirmed cases, and recovered are at 114,218, and deaths is 21,019. So we got a lot of individuals that are going through this. This is going to affect not just us, but it could affect our family members. It could affect our loved ones. This is spreading pretty bad. So my biggest thing that I want to put there is awareness. And I always say about the high five thing. Number one, you got to, the way to prevent this, number one, wash the hands. When you wash them, you got to do it for at least 20 seconds. Sing your favorite song, whatever it is, but do it for 20 seconds. And when you do it, please wash thoroughly through your fingers. We're talking about scrubbing through back and forth like this, even get the nails. We're talking about everything through, in and top and the bottom of your hands. So when you scruffing, you are scrubbing and scruffing these hands so hard for at least 20 seconds to make sure you get all the dirt off and all the bacteria, and especially if the virus is aware, actually not aware, but if it's on your hand, you definitely want to make sure you wash that very thorough for 20, I always say 25 seconds, go a little above and beyond. But the other one is the elbow. When you cough or you sneeze, make sure you flex that elbow, cough in your elbow. There's no reason to use your hand to cough and sneeze, because that's just going to spread even more. Stay away from door handles, touching all that stuff. You can't really stay away from it, but be precautious. After you touch that, wash your hands, guys. You're going to get tired of washing it, but it's better than getting sick and tired from the coronavirus and leading to other complications, which are talking about ARDS, acute respiratory distress syndrome. I remember taking care of, it's kind of off topic, but I'm going to tell you real quick, taking care of a patient with ARDS, rode a prone bed, turning around for at least about 2 to 3 days. Recovered, did great, but it was just a huge eye-awakening experience to see someone going through ARDS without this type of coronavirus, and it's just affecting so many individuals. And we'll get into that in a little later, but I just kind of want to spread a little awareness on how to take care of yourselves, guys. So the other thing, guys, we touch our faces so many times. You don't even want to know how many times we touch our faces in a day, let alone in 1 hour. It's a lot, and I don't have the number in my head, but we do it all the time, guys. So please stay away from touching your face. Like I said, try to use the elbow. If you got a nose itch, if you touch your face, get a tissue, kind of rub it, whatever you need to do, guys. Keep safe distances. We're talking about at least 6 feet, because whenever someone's talking, you know, sometimes I like to speak pretty close, but when it does, it's droplets. I mean, I'm making it rain. I'm not talking about cash flow. I'm talking about the droplets in my mouth, because sometimes when I speak, you know, it's just coming out. And so I always say not 3 feet, but 6 feet. And that's what CDC recommends. And also the health, public health wants us to do too. The other one is to stay home. A lot of people keep asking me, well, how long do we stay home? They say stay home for a couple of weeks if you have signs and symptoms, which is number 1, a cough. Number 2, a fever. We're talking about the fever that's at least above, you know, 99.1, 99.8. I could differentiate, guys, but if you have a fever that's just onset, it goes up to 103. I've been hearing cases on that. Temperature's pretty wide, and that's an important thing. If you have a cough, fever, and of course you're sneezing, and you just feel lightheaded and dizzy, these are a lot of different signs and symptoms, but it's so important to just understand what those signs and symptoms are. So stay home if you can. We do not want to spread this to our family. Now we're talking about another situation here that's kind of arising, guys. When I say family, we're talking about our family members. Now, if you got your family members that are close by the house, please try to do your best. If you're working in the healthcare field, like I am right now currently, stay away from your family, because we are dealing with this virus. They're saying that right now it's so active for quite some time. I can't give you the how many days it stays active, but you will not have any symptoms for quite some time. And that's the unfortunate part, that right now currently public health, CDC, are trying to understand this virus, how strong and powerful it is, that when you do have those, stay away from the family members, especially us working in the healthcare field. So don't quarantine yourself, but stay really, really distant from the family. I don't know how else I could say this, but the way I did it, guys, was I pretty much locked myself up in the room for a little bit. You can't do that forever, because you have to go to work eventually, but just clean, wash, and make sure that you guys are definitely sanitizing anything and everything in your path. But that said, we got to remember, with older adults that are 65 and above, they're going to be a little immunosuppressed. You know, they're going to have different type of comorbidities. They're a little older. Their immune system is not as strong as when you're young and healthy. So when I do say that, I remember, number 1, when this COVID-19 virus was coming out, they said in Wuhan, down in China, it did start really slow, but it increased so fast that individuals were getting it so quickly, and I started seeing how fast and rapid this was. So it really concerned me with individuals who have heart disease, who have, you know, diabetes, endocrine disorder, or also who has lung disease. Anyone that even smokes, OMG, that is number 1 right there. Well, they're all important, but if you guys don't want to definitely get this spread with your family members, ones that have comorbidities, they're immune suppressed, and so forth. So I would say wash your hands, stay away from the family right now. We know this disease, why do I keep saying the disease? The virus, it's spreading so much and so quickly that it does concern me just a bit, because in the healthcare field, if our healthcare nurses spread this because we don't have the proper equipment, the PPE, the N95 mask, the gowns, and all the protective gear, we are just going to continue to spread this, like I mentioned before, mitosis. So I wanted to kind of break this video down to guys, for all of you that's in the nursing field right now or nursing school. And like I always said, guys, I'm going to go through it one more time. If you're experiencing cough, fever, tiredness, difficulty breathing, those are the most important cases right now. If that happens, stay quarantined. Stay in your house. Don't go out. You might want to just stay in one little room. Do not go out and get anyone else sick. Talk about it to your family, but social distancing is important. Right now, we're just kind of going through this real time. We're trying to figure out what's going to happen with this virus. We definitely want to slow this down. The only situation that's increasing is that we don't have the proper gear. That concerns me so much, guys. But I do want to tell you guys, everyone in the nursing field, everyone right now that are students, everyone that are working in the healthcare field, please, 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 do your best to wash your hands. Use that elbow to flex, to cough and sneeze. And also, don't touch your face. I know we do it all the time. And keep that social distancing, guys. If you feel sick, stay at home. I do want to mention this last thing for all my cardiac strong nurses out there. I'm going to say one thing I got to put out there. And I want to just put this for everyone out there. It's real quick, guys. It's just my favorite little verse. Simply trusting every day, trusting through a stormy way, even when my faith is small, trusting Jesus, that is all. And that right there, guys, I don't know, it's one of the good books that I've been kind of reading, Trusting in God. One thing that's kind of been getting me a little more close to God and my faith, we always said that, you know, God is our heart, but he will test our mind. Right now, a lot of people are nervous, scared, anxious. They're upset, they're angry. I call this not the pandemic. It feels like it's a plandemic. I know that's unfortunate to say because this should have been planned for us better with protective gear and how to be ahead of this for us in the healthcare field. But what my main purpose of me bringing up, you know, trusting in God is the faith is getting tested. Right now, more than ever, we need to be in the front lines, which we are right now as nurses and everyone in the healthcare field and my medical doctors and so forth. But we need to stand together. Instead of this me at the markets buying toilet paper and water. Come on, guys, that's silly to me. It's all about we. Forget the me and produce. Bring out the we in us, guys. So we are definitely here not to go against each other, and you know, we got to collaborate in this right now. So this is the most important thing, guys. My fellow nurse brothers and sisters, I didn't mean to make this 11 minutes, but most importantly, guys, I'm gonna read one more verse that I do have right here for you guys. And this has kind of got me when I've been in my little solitary confinement, as you could say. I've been sitting in my room, spending a little more time by myself with the big man upstairs. And this is the one that really stood out, guys. This is what really got me. And it's really important because it did say right here, God has spoken to him now. He needed to think about it. He would carry out the task. It is possible that we keep going and doing the wrong things because we are not alone often enough. Now think about that. We make many mistakes because we do not set aside enough time to be alone with God. So right there, right then and there, guys, I'll say this. This is my new favorite verse that I've been just kind of focusing more on God. Jeremiah 33, verse 3. Call on me and I will answer. Show you great and mighty things which you do not know. Marinate on that. My fellow nurses out there struggling, going through this pandemic. I'm praying for you guys. Let's continue to save those lives. Let's continue to, most important, take care of ourselves so we can go ahead and take care of other families and so forth. But y'all guys, I really love you guys. Peace, love, advocate, and wash them hands. Love you guys.